IVF has changed considerably in and out of the laboratory. One of the first things that has changed, the pharmacology, has enabled us to control ovulation and superovulation, meaning, ovulation of more follicles, much better now than we used to be able to, and that there are medications now, GnRH agonists and antagonists, that enable us to control when eggs are released. So that's been a major advance. Secondly, I think another major advance is the way in which we can access follicles. Used to require a surgical procedure called a laparoscopy, and for the past at least I think 20 years now, we've been able to do this by ultrasound guidance without having to laparoscope patients, which is a much, much easier and more efficient way to go, and it's much easier on the patient. Once we get into a laboratory, the technology involving something called intracytoplasmic sperm injection enables us to inject individual sperm into individual eggs to create embryos in people who would otherwise be unable to create embryos. Advances in the laboratory have enabled us to monitor embryos until they reach what's called the blastocyst stage at day 5 or 6. And we're therefore able to replace fewer embryos and create better rates of pregnancy. And I think most recently we've been able to genetically analyze these embryos before they're transferred in a very accurate way.